to ICD-10-CM Coding Basics, Understanding the ICD-10-CM Codebook.
The goal of this lecture is to help you learn the basics of ICD-10-CM coding with a specific focus on how to look up diagnosis codes. You'll need to have your ICD-10-CM codebook to follow along during the lecture. You'll also want a pencil or pen and maybe a highlighter to make notes in your ICD-10-CM codebook. You may pause this lecture at any time should you need some extra time to find your way around the codebook. To start, let's spend some time looking at the structure of the ICD-10-CM codebook and become familiar with navigating through the codebook. The very front of the codebook contains coding conventions and the official ICD-10-CM guidelines for coding and reporting. These are discussed in another section. After the ICD-10-CM guidelines is the Index to Diseases and Injuries, which is also referred to as the Alphabetic Index. This alphabetic index is where we start to locate an ICD-10-CM code for a particular diagnosis. There are also two tables to help guide us in the right direction, which include the table of neoplasms and the table of drugs and chemicals. These are followed by the index to external cause of injuries. The tabular list follows the index to external cause of injuries. The tabular list is the section containing the actual numerical ICD-10-CM codes and their descriptions. The ICD-10-CM Index to Diseases and Injuries is an alphabetic list of diseases and injuries and is also referred to as the Alphabetic Index. The Index to Diseases and Injuries uses an indented format. A main term is listed in the Alphabetic Index in bold lettering, and the subterms are indented under the main term. When we look for a diagnosis code in the Alphabetic Index, we may find the correct code as an indented entry under a main term or next to additional terms indented under a subterm. For instance, take a moment to find the main term history in the Alphabetic Index. The first indented subterm under history is family, and then it has additional indented subterms listed in alphabetical order. These are different medical conditions that can be reported to describe the family history of a patient. Under history and then family, you will see alcohol abuse, allergy, NEC, anemia, arthritis, etc. The indented terms under the subterm family continues through to visual loss. The next indent at the same level as family is the subterm for personal. The indents under personal pertain to the personal history of the patient.
Now it's your turn to try.
Out of hand. Thank you. Bye-bye.
Now let's go over the table of neoplasms. This table has the index entries for the locations of neoplasms alphabetically. This is where we will locate the specific site of the neoplasm to be coded. This is followed by 6 columns to specify the behavior of the neoplasm. The first 3 behavior columns are for malignant neoplasms. The remaining behaviors are benign, uncertain behavior, and unspecified.
Click on the information icons to learn more. Now it's your turn to try.
The second table, Table of Drugs and Chemicals, is found just after the table of neoplasms. The table of drugs and chemicals is used to identify the substances and causes for poisonings, adverse effects, and underdosing. Codes in this table are combination codes that include the substance that was taken as well as the intent. Do not code directly from the table of drugs and chemicals. Always verify the code in the tabular list. The codes in the table are organized in a 6-column format.
Now it's your turn to try.
After the table of drugs and chemicals is the external cause of injuries index. This set of codes describes how the injury occurred. If a patient has a broken arm from a fall, you can look in this index for fall, and it will have a list of types of falls. Without further information about the fall, W19 would be selected. The code is verified in the tabular list to assign the remaining characters for a complete code. The notes at the beginning of ICD-10-CM Chapter 20 in the tabular list define transport vehicles and explains the structure of the chapter. This will assist the coder in finding the correct external cause codes to report and will be discussed further in later chapters. External cause codes are never primary and always follow another code. The next section is the tabular list of diseases and injuries. There are 21 chapters of numeric codes that classify diseases and injuries, beginning with A00 and going all the way through Z99.